Lighting.
Hello dear friends, myself Dr. Sonu, the microbiology faculty of yours at LN Next. Ma'am.
I'm Dr. Anupama Chaudhary Devgan, your physiology faculty at Allen Next.
I'm Dr. Siraj Ahmad, your faculty of Pharmacology at Allen Next.
And myself Dr. Amit Jain, I'm faculty of Biochemistry at Allen Next.
And we are here for launching up of the foundation course. And this particular foundation course is designed in a wonderful way. And important, you know that what about the foundation, the name itself telling up that what's the need of a foundation stuff. And pre and para, like as we all know that recently ma'am, next is being introduced.
Right.
And the importance of pre and para in that obviously is of wholesome. Why? Because these are the crux, these are the bricks of your foundations. In fact, your MBBS, if you think like a building, so these are the foundations of yours, and over that you have to build up that particular beautiful building of clinicals. Ma'am, you want to add something?
Yes, so we are launching this course exclusively for first prof and second prof students, where your subjects, your first prof and second prof subjects will be discussed in detail by the faculty. And these will be available as recorded lectures for you to access them whenever and wherever you want them, want to access them from. Then we will also be involved in not just preparing you for the next exam, but also for your college, university exams.
Right.
And you see, everyone says that this subject is important or this subject is less important or other one is more important. But I say that no subject is less important. Every subject is almost equally important. But when we talk about foundation, right, definitely these are the most important subjects. And I will talk about my subject like pharmacology. Why is it very, very important? Because see, in anatomy, definitely we'll be reading about the structure, normal anatomy. With MAM, physiology, you'll be learning the normal functions. Biochemistry, at the molecular level, they'll be discussing. Pathology, they'll be talking about the diseases. Medicine will talk about diagnosis. Radio will give you some hints in diagnosis. But where will you learn how to, and what all drug to give? That will be in pharmacology. So definitely your foundation is going to be made here in second prof itself. I mean, in pharmacology itself. So definitely these foundation courses are not only for your next examination, but also for your clinical practices. That is one of the most important subject. Sir.
Yes, definitely. In this course, actually, what I would say that we have designed a flow chart to success. Right. This will be like a pathway to success.
Right.
So from the very first year, like when you come up, so there is anatomy, there is physiology, and there is biochemistry. And you know that without the proper anatomy knowledge, you can't be a good surgeon. Okay, and without physiology, you can't be a better practitioner or a medicine fellow, because you should know that basics, physiology of the organs and all, how does they work and what all is to be remembered in them. Okay, like cardiac cycle and all. So ma'am beautifully tells about that, and she like simplify the things in the best way. And ma'am, you want to add up on the first year something?
Definitely. I strongly feel that if your knowledge of physiology, pathology, some microbiology, and pharmacology, if it's strong, medicine is cakewalk. If these subjects you focus on in your first and second years, you'll find medicine very, very easy to navigate. Otherwise, I'm sure by this time you know that medicine, just those volumes of medicine are so daunting.
True.
But if your foundation is strong, if these basic sciences are good, then if you've studied them well enough, your concepts are clear, it becomes so easy to navigate medicine. And similarly for the surgical, if your anatomy is good and you're able to apply that to your knowledge of surgery, it becomes very easy for you to navigate your clinical subjects.
Right.
True.
And very importantly, as far as the first year is concerned, I always tell students to read your standard textbooks. And I'm sure that
Right.
you also advise
We all always.
the second year. But the problem is, like for instance, I can talk about physiology. Our standard textbook, of course, the Bible is Guyton and Genong. These are two very, very important textbooks. Now, if I ask you to study these textbooks, it becomes a little difficult. I'm not saying impossible, but a little difficult because there is a lot of information which is given in these books. So in our classes, which are based on standard textbooks, we simplify the topics and present them to you. So that the moment we simplify these topics, they become palatable. And now if you go back and read that topic from these textbooks, it becomes much easier because you know exactly what you have to focus on.
True.
Right.
True, ma'am.
Totally
And
agree.
you cannot say, no, I'm not going to do the standard textbooks. No, because I think this, you have to start from first year itself, that standard textbooks have to be read. You have to go through them because this is what is going to build up your
base.
yes. And we will help you in simplifying those topics, telling you what is important, how are you going to attempt your questions in the university exam, what are the keywords that are required in an answer. And similarly, at the same time, you will all be preparing for the next exam, which is 100%. All of you who are watching us today, first and second year students, are definitely going to take the next exam. So we have to
Start
make
from the
exactly
very
from
first
the
year.
first day
Right.
itself.
True.
Yes.
So I think we can talk about what all do we have
Yes.
in this foundation course for all the students. And meanwhile, we can take all the queries as well if the students are having any queries. Ma'am?
Mhm.
Yes. So I can move the side a little bit. Yes.
So this is like our foundation courses, and obviously this is basically like wonderfully targeted for the Prof 1 and Prof 2 students, MBBS students, and yeah. So as you can see up that we have already introduced up, but these are our Prof 1 faculties like
So
Anupama ma'am.
Yeah, so I'm Dr. Anupama Chaudhary Devgan, and I have been teaching in medical colleges for the last 25 years. And I've also been associated with the Coaching Institute for the last 17 years, where we were preparing students for the NEET exam, the INI CET, for USMLE. So definitely I bring with me an experience of 25 plus years. And what I've found is, as far as physiology is concerned, students generally find it a little difficult to understand because this is a completely conceptual subject. The concepts have to be built up, and that is what I am, my effort, my endeavor will be to clarify your concepts, to make sure you understand them and you apply them to clinical medicine.
True. Ma'am, do you want to give some examples like in which particular thing the first year students they mostly remains puzzled up and all that? Some topics and all?
Yes, the over across the board and across the medical colleges and across the country, what I've come across is students find CNS very tough.
Okay.
And my endeavor when I'm teaching CNS is to actually make it sort of logical, conceptual, logical, so that it's very easy to apply all that knowledge to diseases and how they are going to affect what are the lesions and what are going to be the effects of those lesions. So the important thing is to make it simplified, and to then we use the help of flowcharts, mnemonics, to make it easier to remember concepts, to develop on those concepts. But my main focus is that you should understand and build up your concepts.
And that's what is needed in next, ma'am. I suppose so.
Absolutely, absolutely.
Integration is very much
Integration is very
because
important,
they are
and
good in
those
physiology,
concepts
definitely
should be there.
Absolutely.
They can integrate with all the diseases.
वो रटने की
रटने की
जो
जरूरत नहीं पड़ेगी।
वो जरूरत नहीं पड़ेगी।
That rod learning is going on,
Yes.
for sure. But you should have a concept
Yes.
right from the first year.
Right.
Absolutely.
Sir, do you want to add up in the first year
Biochemistry.
something?
Yes, biochemistry.
Biochemistry, the most dreadful.
Yes, actually it is considered
Dreaded.
most
Dreadful कहेंगे,
Yes.
dreaded कहेंगे, डरते हैं हम लोग सब।
kind of, yes, right, I'm right. So what I have tried in the last 10 years is to simplify this, up to that point that students are, I always get like the comments from the student that, sir, this is the first time I am able to understand the subject, right?
Okay.
And I usually always thought that this is a subject that I have to just, mug it up. There are just chemical reactions and nothing else. But I started integrating this subject already with the clinical concepts since started teaching in 2012. So definitely, we will have a lot of fun, right? Simplifying the concepts and making them just, what I can say is appropriate for your NEXT exam.
Right.
Dr. Siraj, do you want to
Yes.
add something?
Definitely. So in the second prof, as I have already mentioned previously as well, that pharma is one of the very, very important subject where you'll be learning about the drugs. Now most of the students are actually a little scared about whenever they hear the term pharmacology,
True.
because there are a lot of drug, lot of interaction, lot of side effect, and
Classifications to
lot
remember.
of classification to remember.
Uh-huh.
So what we do, we use lot of funny stories and mnemonics. If any one of you have attended the classes, you can never forget those stories. See, I can say that you will read about a drug, you might forget, but when I'll try to integrate those stories in form of those drugs in form of a story, right, or the entire classification form of a story, definitely you will tend to remember, you will end up remembering things. And after that, what I only recommend is just go revise once and everything will be clear cut, everything will be sorted. So all those classes that we have taken, we have been taking and we will be taking, definitely will help you out. And I'm coming with LNX with 7+ year of teaching experience. I have been teaching for our NEET PG, INICT, FMG students in India. And also I have been working as a visiting faculty in countries outside, abroad countries, right?
Mm-hmm.
In countries like Russia, China, Philippines, and other countries. So all the experience that we are coming up with definitely will help you guys in simplifying pharmacology. Nothing more than a cakewalk for all of you guys.
And sir, as per your experience, you find the students struggle up in certain topics which you find up.
Yes, definitely. Students are struggling mostly, I see, in general pharma and ANS. Most
Okay.
of the students are struggling in ANS. See, when I was in class 12th, I always used to tell to the students that I was struggling in physics.
Okay.
And one day I met a very nice faculty and he said, if you're struggling in physics, that's not because physics is hard, that's because you haven't met any good teacher.
True.
Physics
True.
is such a subject. And he taught me in a way that I was able to do questions, I was able to do things. Likewise, when I say that pharma, most of the students are scared of pharma. And in that scaredness, they are not reading it. They are not reading it. They are not understanding it. They are not understanding. They are taking it as a burden.
True.
So this becomes a whole, cycle.
It's a vicious cycle.
Vicious cycle. It becomes a vicious
Absolutely.
cycle.
Yes,
So
yes.
that is the cycle we wanted to break here. That try once and definitely you will
We try
not
to make
regret.
it palatable.
Exactly. Well,
Mhm,
exactly.
mhm,
So ANS is one topic, and one of the very important and I would say very favorite topic for me is ANS and antimicrobial. And
Okay.
these are the two topics which students are always
They struggle.
struggle.
Mhm.
And I try to make it as simple that once you go through this chapter, you will never say that this chapter is difficult for me. That is the promise. Yes.
So that is our confidence, definitely, right? That we will make, the things very easy for you.
And the guys who are in second year, they must be knowing up how interesting is microbiology.
Right.
Huh? So
Micro. It's not micro. It's macro.
it's macro actually, and you know that so many facts are there. And if you don't go up in a systematic manner in that, you will never able to understand and learn about that particular microbes and all, because there are so much,
Yes.
and every particular microbe is having a particular property. That this is a catalase positive, this is oxidase
And there
positive,
are
and
a lot of
most
things,
of
I
them
think, lot of things overlapping.
overlapping also, that this particular reaction is positive in this also, that also. So whenever you go for a planned way, what I've done, that in the starting I've given a gist that these are the bare minimum first of all you should know, and that will be the foundation. And after that I've started up systematically, like gram positive cocci, gram negative cocci, and after that gram positive, because what the students try to do, they try to remember bacteriology at once. And whenever you do that, you will always be at loss.
Right.
Why? Because gram positive will move into gram negative and gram negative cocci will move into gram negative bacilli. So systematic approach. This is what is our foundation course is bringing up, that will make that thing palatable for you. Okay. So it's like a well-known fact also. If you become systematic, means firstly I will end up with gram positive cocci, then gram negative cocci, then gram positive bacilli. If you go up in this way, then all things will be recruiting up in your memories in a proper way. Otherwise, firstly you read mycobacterium, later on read something else, so you will always be confused up that what I am reading up and where I am going off. Okay, so this is what is the approach of ours in the foundation course,
Right.
that we try to make you understand that this is the way to go. Okay, and when you find this, that this is the way to go, you will easily able to walk away with the wonderful results.
Right.
So, talking about the course itself. Please say, from this. Okay. Now, we have talked about the first prof, and this is our second prof, myself, Dr. Sonu Panwar. Along with us, the pathology faculty, Dr. Sushant Soni, having experience of 8+ years. And now only we have talked about Dr. Siraj, pharmacology, 7+ years experience. Okay.
We forgot our anatomy faculty. Dr. Ankit Khandelwal will be our anatomy faculty.
Yes.
True, true.
Yes.
And I suppose he is joining up?
Yeah, he's joining us.
Joining us in this live. So, what exactly what we have in this foundation course? Dr. Siraj, you want to add upon? Tell please.
Yes, basically in this foundation course we are having more or less around 275 hours of lecture, and this 275 hours lecture will be divided into two, that is 125 for Prof 1 and 150 for Prof 2. So collectively, I mean total we are having 250 hours, and not only that, these lectures are well curated, especially for our second year students, those who are needing the very basic concept and they need the very basic kind of guidance. For those kind of students we have this. Not only this, we are also having some important rapid revision videos as well. So let's say you have read already all the subjects of subject like let's say physiology or micro or pharmacology or other subjects of Prof 1 or 2. After that you want to revise. Let's say you have exam 2 to 3 days, or you are having.
You are not read.
Right? You have not read well. So for those kind of students, we are having rapid revision video. So you see, whatever we have discussed in our usual regular classes, here in the rapid revision it will be concised. So entire Prof 2 will be concised in around 30 hours, entire Prof 1 will be concised in around 20+ hours. Now this is not the replacement of the regular course. No,
Yes,
I would never say that.
yes.
I would never say that. This is only for revision, and this will mainly help all the students, those who have read from the regular courses. They will be able to go through in a much better way.
There will be high yield, more of high yield.
Yes, high yield.
High yield.
It will be high yield, and you will be able to revise very rapidly in this.
In fact, they will be able to understand this when
Yes,
they have the depth knowledge of
depth knowledge of the regular classes.
regular ones.
Right, right. Sir, over to you.
Ma'am, you want to add upon?
Another very important point that we also will be having the practical videos included in the foundation course, especially for the first Prof subjects. That is, for instance, I can talk about physiology. All your practical videos will also be a part of the foundation course.
Yeah, practical knowledge is also important to
Absolutely,
pass up the
absolutely.
Prof exam. So
Right.
that also we are including up. That which particular per my subject, like which stain you will be doing up in practical exams,
Correct.
acid fast staining, gram staining, and all. And these all will be covered up in this particular course.
So,
and ma'am, you can also add upon the
Yes,
practical knowledge.
and we will also be focusing on the kind of questions which are asked in your vivas in those practical videos. You
Oh,
know that vivas
definitely.
are so much
Yes,
a part
yes, yes.
of
True.
practical exams.
Right.
So we will also focus on that. What are the kind of commonly asked viva voce questions?
Right.
And sir, yours, like practicals, what they ask nowadays?
Actually, in practical also, pharma earlier we had a lot of practical like animal experimentation and all, but now we don't
Yes.
have much of a practical.
Mhm.
So most of the practical aspect is kind of a theory only. But
Okay.
definitely we'll try to cover those theory portion as well, and what are the type of question that they are asking
Mhm.
in viva voce. Those kind of
Mhm.
session also we'll try to cover in these foundation courses.
Mhm. That will be great.
Yes.
So you?
Yes, definitely we will, like in biochemistry, the principles of the experiments are very important, but examiner ultimately ends up with asking the question with application part, like what is the application of this particular test that you are doing in the general practice, in the hospital when you see the patient. So definitely we will integrate that chemical part with the clinical part. So chemistry to the clinics, definitely we will link them together.
That's very nice.
Maybe we can talk a little bit about the extra edge videos as well.
Yeah.
Yes.
Yeah.
So
We are for them only.
Yes.
Extra
So
edge.
we had in the recorded videos, you will have your all the topics are discussed, but there are some which we have included in what are called the extra edge videos. You can access those extra edge videos once you've done the main segment. Now, what are these extra edge videos? These are basically, there are some topics which come under desirable to know.
Right.
There are topics which are must know, which are your
Mhm.
main videos, and there are some which are desirable to know, which we have included in Extra Edge. So the benefit of doing that in Extra Edge is that once you have a concept, let's say, let's take an example of respiratory system or respiratory physiology. Once you've done the main segment, then there are certain concepts which I have discussed in the Extra Edge, which are a step above. So once you've done the main segment, then look up the Extra Edge videos as well. Like I said, these are your desirable to know topics.
Because like a clinician might have any sort of a case. He
Absolutely.
can't say that I have not read that particular one, that is a above level, edge level. So we have covered that also. So that is what is our important thing is, like in foundation course, we are giving that extra edge
Yes.
to you, that in the Viva exam, the maximum marks will be awarded to you itself.
Like I'll just give you one simple example. For example, in the standing position, there is a gradient for the ventilation, perfusion. There is a gradient. Ventilation is maximum at the base of the lungs and decreases to the apex. Perfusion is also maximum at the base and decreases towards the apex. But the VQ ratio increases from base to apex. So the highest VQ ratio is at the apex. Now, just this is included in the main segment. But in the extra edge, I've gone into detail explaining why is this happening. So a brief explanation in the main segment, but a much more detailed. And then what does it mean? What is the significance? Why do you have, we spoke about, all about what has happened in COVID and what were certain positions that were recommended to patients who had respiratory symptoms. What is the reason for that? So all that comes under extra edge.
Right.
So this is how we've divided it. Get your basics clear in the main segment and then develop your knowledge and take it even a step ahead and in the extra edge videos.
So I think we have covered here regular courses, extra edge, and also rapid revision. In addition to that, like I'm sure all of you guys are also preparing, and you're already thinking about getting your PG seat, and that is going to be possible, especially for our first year and second year students after giving next.
Right.
So for them, you will be practicing MCQs or your exam pattern question. So I think we can see this, that there will be around 1500 plus question in Prof 1. And for our Prof 2 students, we are having 2000 plus. Now, this is at present. But as we move along, there will be increment in these numbers. But if you are doing this basic number of questions, definitely you will be able
And these
to,
all are next base, sir?
Yes, or most of the questions here are next based integrated clinical questions. Well curated by the faculties, not taken from anywhere else. And also we are having a segment of PYQs. I mean, especially
Yes.
because next base is what? Next base will not, it's not going to come from Jupiter.
Yes.
I
True,
believe
true.
next base will be taken by someone
Yes.
from
Important topics
yes.
is always really important, sir.
Exactly,
Yes.
right? And the faculty will be somewhere around us, right? So the question, the concept, the pattern of asking question, it might change a bit, but overall the essence remains the same,
Same,
right?
absolutely.
True.
So just a little bit, sir, could you talk about the race questions?
Yes,
That
race.
is something
Ma'am,
which
please.
is
Ma'am,
right. So every topic that we have taken, every chapter is divided into
Right.
a number of subtopics.
Smaller topics, yeah.
Like for instance, nerve and muscle physiology, I've divided into 12 smaller topics. Now, each one of those smaller topics will have race questions. These are questions which have been made by the faculty. We have given you a very detailed explanation. So what we expect you to do is, once you've done a particular subtopic video, you've gone through the video, we want you to go through the race questions as well. And we want you to be able to get all those race questions correct. If
True.
still there is some sort of deficiency, you feel you could not answer one question, we would always recommend you to go back to that particular
Topic.
segment
Topic,
and do it once again and come back to the trace question. So the idea is that every subtopic, we want you to have a thorough understanding, test yourself on that subtopic, and then move on to the next one. So that is like you've got, what are we basically doing is basically breaking down every chapter into smaller subtopics for you and making sure that each one of those subtopics are well understood, that you have been able to grasp all those concepts and then move on to the next one.
In the race, I think whenever they watch a small video, immediately after the video, few questions pop up. It will be around, for a smaller topic, 4 to 5 questions.
Correct.
And when
Depends
we say
on the
race,
length of the topic.
yes, it is
Yes.
the rapid assessment and continuous evaluation, right? Rapid assessment through continuous evaluation, right?
Yes.
So you will be testing yourself through these small videos and small MCQs, and definitely we'll be having topic-wise MCQs as well, chapter-wise MCQs as well, grand test as well. Everything else will be there. But this race is also one of the very, very important segment of this LN Next Time.
Okay.
This is the one, yes. Inclusive of PYQs, general questions, and race question. This is what ma'am was talking here. So next.
And these all are closely patterned up. Because as next is approaching up, so we have kept it in that particular fashion only, that's all integrated. and you should have the right knowledge from the first year itself,
Right.
that how to solve up the questions of the final year.
Right.
Yes. Let's see the next slide. Yes.
This is one very important.
This is something which is very dear to my heart, because I feel that unless you have a chance to sort of have a live and interactive discussion, things are a little incomplete.
Correct.
So this is what we are planning. There are going to be online tests, at least 15 plus pattern-based test and discussion. The important word here is discussion. After the test, the faculty comes in live, and we will discuss those those
Okay.
questions with you. And so that is also, you will also get an opportunity to ask your doubts. So this is going to be an interactive session where you will have a chance to meet your faculty and discuss any doubts that you might have
Right.
about the test or about that particular topic.
Yes.
And I think
So-
nobody is providing this
Yes,
on any of those
absolutely. At
platforms.
least for the
Mm.
first prof students, this becomes so important, because I strongly feel that at least this is what happened when I was a student,
Yes.
that you always hesitate to ask your own teachers.
Right.
You know, you always have that feeling of being judged.
Yes.
So you hesitate to go up to your, your own teachers in
Professors.
college.
Mhm.
And this platform is an informal platform. And here we are not there to judge you at all.
Yes, exactly.
So, so you should feel free to ask even the silliest of doubts.
True.
Something maybe a senior or a friend may not be able to help you with that, and sometimes they may give you an answer which is completely incorrect. But we want you to feel free to ask questions, clear your doubts, so that there is absolute clarity on that particular.
Basically, one word, one hand holding.
Hand-holding.
Yes.
Hand
This is
we
what is called
understand.
hand holding.
We totally understand that these first year and second students,
Yes.
they need a lot of guidance, lot of
Yes.
hand holding,
Yes.
because that is what
They
are
have
going
come
to-
from
yes, exactly.
Just
Directly
passing up
from
the
12th.
entrance exam.
Yes,
Mm.
and there's a lot of lack of confidence as well.
Absolutely.
So that is why we want to make sure that you feel free and feel at home, feel at ease, and ask any kind of doubt. And if you feel that this is silly kind of doubt, you must ask that silly doubt as well. Because
Mhm.
once that doubt remains, that will
Mhm.
remain for lifetime.
Lifetime.
This is
Actually,
what I
that
feel.
happens.
And,
If you remember your first year,
Yes,
we
totally.
after we were all probably toppers in
Exactly,
school, and suddenly
exactly.
when we went into medical college, and suddenly our grades and marks plummeted.
Exactly.
Because
True,
we
true,
found
true.
it so difficult to
Yes.
handle our first MBBS subjects.
Mhm.
And I genuinely feel that I wish I had someone to help me with,
Mentor,
yes,
guide.
mentoring me in that, especially the first year,
Exactly.
True.
where everything was absolutely new to me, and
Mhm.
this is something.
And I think the first year students, they must be like thinking of this way itself, because they are feeling of the same thing. Because this is what is the continuous cycle. They are also new, and the new things are coming in physiology, new things are coming in biochemistry. So you want to add something?
Yeah, definitely in these tests, what we will be trying to put up is all types of questions, especially like sometimes when we are giving the exam and there are spotters, and they are something like we feel like alien. They're like the things that we have not seen properly, and we don't know exactly what is the use, what is the principle. So in these tests, we will I think, ma'am, yes, we can try to put
100%, 100%.
these questions also, so that you will have it definitely the 360-degree preparation for your exams, even the prof exams, and even for your future exams.
Next exam.
Exactly.
Next exam,
Next exam.
absolutely right.
So take the next slide, please. The notes.
Yes, another very something which I'm very proud of at Allen Next, the digital notes and annotable notes.
Yeah, these are annotable notes, and they are wonderfully referenced up also. And this particular one is done topic wise, tagged up, and they have the wonderful pictures also, like in the anatomy, physiology,
And it's all full colored.
it's
all
full
fully
colored,
colored, fully colored.
and that you'll able to see them and understand them in a proper way, because after the lecture you might be finding some things missing. So that particular thing will be sorted up by these digital notes.
Right.
Okay.
And not just digital,
Yes, they will print.
annotable, and you also have printed
Printed
notes,
notes.
which
So
is
printed notes will
something
be there.
exclusively what
Exactly.
Allen Next is
LNX.
doing. Yes.
And printed notes obviously are, as sir said, very colorful, and you'll be able to appreciate up all the pictures of anatomy, physiology, diagrams and all wonderfully in that. And the most important thing is like they are perfectly matched up with the standard textbooks, and the basic purpose of ours is itself that we should inculcate in you the reading habit of basic books, because sir and ma'am, they are missing out on this thing nowadays.
Absolutely.
They are just reading up the notes and
Yes.
they are leaving up the basic books.
That is the reason for the origin of next.
Yes.
Yeah,
This is
true.
what I understand.
And there is one thing like I feel like when I was student, I used to feel like, you know, right now what I feel is I want to read first and then I want to listen. Even you can do that. You can read your notes first and then you can listen to the lecture. So in both the ways.
There is, you know, the kind of students that we've come across, Dr. Sonu, Dr. Siraj, you agree with me, there are some who want to write.
Right.
Yes.
And some who have already started using their iPads and they want
Right.
digital notes.
Right.
So we are
True.
catering to both the
Both the type of crowd.
both the Gen Z, so to
Yes,
speak,
exactly.
the ones who want digital notes as well as.
But ma'am, you will agree that self-made notes are the best one,
Yes. Yes.
and the memory retains them the best.
Absolutely.
So writing in itself, I always say, it's a form of revision. When
Yes.
you're listening to the class and writing, that in itself is a form of revision, I believe.
And when you go back to your notes, and if they are
Yes.
written by
By
you,
your-
you recognize your own handwriting, that gives you a sense
Exactly,
of self-confidence.
And ma'am, you can add upon to this that which all sensory levels they come into
Yes,
that.
I always insist, I always tell them this, that if you're writing your own notes, that look at the number of special senses which are involved, somatic as well as special senses which are involved when you are writing your own notes. So obviously the retention increases and your ability to recall also increases. There is a visual input, there is auditory, you are writing it yourself, and so that becomes, the output becomes that much
Right.
better.
And all these notes that are there in the app, they are well organized.
Very
Not
well
only organized,
organized.
they are tagged as well. For example,
Yes.
if you are
Topic-wise.
right, topic wise.
Yes.
If you are, let's say, you are solving some MCQs of CNS. Let's say you are solving anti-epileptic drug. You can directly go to anti-epileptic drug. So lecture will open in parallel. The same notes will also open. So not only they are well organized, they are also well tagged as well, so that you don't, you will not feel out missing on the app.
Yes.
Don't you think things
Suppose-
have become really easy
Much
for the students?
much easier, right?
We
compared
had a
to ours,
difficult
yes,
journey.
Very difficult.
We had a very
Totally
difficult
understand.
journey. Yes. And all references are mentioned. All references are going to be only standard textbooks.
Standard test, right?
Yes.
For all the subjects. Yeah.
Yes.
So we will take the next slide.
So they are telling about the benefits like this. Is this course for you? Yes, definitely is for you only. And obviously, we have already told up then which way we have curated it, and you should go for it, I suppose. And in the comment section, I'm reading up like Dear Doc, Abhi Talks, Ravneet Kaur. So they all are there. And as it is being written up in the comment, the registration link is there in the pinned section. So you can go up and register for this. Definitely you will feel that why is this course important for you, and you will feel the difference after having this particular one.
Right.
So, you want to?
Yes. Now, the course is designed in such a fashion that if you move along with us, all your topics will be covered in a very systematic fashion,
Right.
leading you to that ultimate goal of doing well in your university exam and building up the foundation for the next exam. So it is a very systematic, very well organized. We are bringing a collective experience of, if you add up all our experience, 50 plus years, I think. So you have a very highly experienced faculty who is going to try and make sure that you remain consistent, you remain competitive and confident. That is the 3 C's that we are focusing on: consistency, competitiveness, and your confidence levels.
Very right, well said.
Right, ma'am. Now, one thing that I would like to add here, I have seen we are actually visiting to private colleges as well. There are a lot of students there, those who want to learn, they are very much eager to learn,
Yes.
especially in those colleges, and not only in India, outside India as well. But they are suffering from, they are lacking the proper guidance, and they are teaching. Sometimes the students are directly coming to us and they are telling that we were taught about this, but we could not understand, or sometimes the lectures are missing, and sometimes we are not going to lecture because the lectures are not according to what we want. So those kind of for those kind of students especially, I think these kind of lecture and these kind of videos are a blessing for all of you guys,
Absolutely.
which you can watch from the comfort of your city. And again, this is just one part of LNX. Right? If you
True.
want to be a part of offline session, definitely that's a whole
Yes.
different session. Then that's a
Mhm.
whole different level, and we can meet up in the offline session as well in all your cities, right? But here we are only going to talk about these foundation courses. And for all the students, those who are having this problem, I think after this problem should be sorted and solved.
Yes, absolutely. Even if you're traveling, if you are, if you have some time, you're maybe you
Yes.
can still put on your headphones and listen to
Exactly.
what listen to the lectures if you're not. So it's that accessibility factor
Right.
that you can access the videos whenever you want to, whatever is from wherever you want to.
Right.
So that makes it you are the master of your time, and you can access them and learn from them whenever and wherever.
Right.
Yes.
In the era of, I think Netflix, definitely like, these are the lectures that you must see.
This will be
Yeah.
Netflix.
Yeah.
LN Netflix. Right.
That's a good one. Yes.
Yes.
And here, ma'am, we want to emphasize this, that now as next is approaching and it's the fourth year exam, so you have to start up early now.
Right.
There's
Yes.
no like lagging up that I have
Yes,
just
yes,
passed
yes.
on
No.
and just now in the first year I will do the fun and all. So you have to be a bit serious and bit serious only, not fully serious
I
because
say fun तो इसी में है. थोड़ा पढ़ो, regular पढ़ो.
सही बात.
यही तो
Right.
कंसिस्टेंसी का मतलब है.
True.
सही बात.
True.
Study less but study continuously.
लेकिन पढ़ना पड़ेगा.
पढ़ना पड़ेगा. है ना? थोड़ा
Important ये है that you have to
continuously.
study.
Right.
Be regularly irregular, no?
जो बोलते थे ना, एक लड्डू रोज खाओगे
हाँ.
तो पचा पाओगे,
Right.
लेकिन 30 लड्डू एक संग खाओगे तो
Sugar
तो
है.
प्रॉब्लम हो जाएगी.
So this is what we are going to focus on, is that you remain consistent
Very
as far as your preparations are concerned.
important. बिल्कुल,
Yes.
बिल्कुल.
Something we have already told this.
Yes.
So this is what I just told, the build solid conceptual foundation and stay next ready in
So
advance.
definitely this foundation course is for the same, right? To build your concept, to build your base. The base should be very, very strong for you to take up or everything that is going to come across in the third prof and onwards.
Ma'am, here like
Are there some questions? Are there some questions? If there are any, we'll be
ma'am,
happy to.
questions
Yes,
are not-
students, if you are having any query, you guys can put
Any
it up.
questions, please
Any
put them up
question.
so that we can have a look.
There are some
We can
questions.
try and answer.
Yeah, any questions if you have? So we are seeing up in the comment section. So any doubts regarding it? If somebody have, please ask her.
Prabhakar, thank you very much, and all the other students. They are missing you, Sonu sir. So, if you guys are having any form of query with respect to this course, that how are you going to, access these, course, and now what are the different ways to make it more, furthermore, easy for all of you guys, you can definitely put up, and we can take the next slide, sir. Right, this is
Yeah,
done.
already
This is
done.
done. This is done.
So this is like we already telling ma'am, ki now from the first year itself you have to have a clinical concepts and
Right.
So our focus is high-yield
Selective
questions,
high-yield topics.
definitely high-yield topics.
Right.
The frequently asked questions, the clinical concepts. This is exactly what we are going to be
Offering.
yes,
Offering up.
and
Right.
exam-centric approach, definitely.
Right.
At the same time, building up your knowledge of the basic sciences as well.
Right.
Right.
Hemant Mishra, AIMS, Gorakhpur, my place.
Yes.
So do join up. Dr.
Definitely, one student is asking, is it enough for prof exam? Dr. Sautma Mishra. Yes, that is what we are telling. That this is well curated for not only for your prof exam but also for next. So when
Both.
you yes,
We
are-
both.
yes,
It's a both.
because
It's
And
a
even
both.
we are telling practicals are also
Exactly,
included.
Yes,
exactly.
yes,
So there
yes.
will be some practical contents also that will be coming across in this foundation course.
Practicals, Viva, everything.
Right.
Yes.
So that will make your journey of first and second year very smooth.
Very
Yes.
smooth, very smooth.
And we'll be available all the time for you guys, and we'll be meeting also with the help of test.
Yeah,
Online
those
testing.
doubt clearing sessions.
Doubt clearing
that is
sessions
there.
after
Our
the
live
test.
discussions, that is,
Mhm.
that will also be available.
Exactly.
Yes.
Sir, next, thank you.
So that's what they like to tell up, that join up this
The
particular foundation course.
And what are the different charges that we have for the students, those who wanted to take up this course?
So
So these are the pricing for our foundation course for all the students. That if you are buying a 6-month course, this will be you'll be getting 1 month extra, and you'll be getting it only for 4,500 rupees. And if you're taking it for 1 year, I mean 12 month plus extra 1 month will be getting, just by adding 1,500 more, you'll be getting it in 6,000 only for the Prof 1. Then there will be a Prof 2, 6 month, 5,000, and I mean 1 year, it will be 7,000. In both the section, again you will be getting 1 month extra. But if someone is willing to take a combination of both Prof 1 and Prof 2, that is the best deal that I could see here. That for 1 year you'll be getting in 9,000 both, everything.
So that is wonderful deal.
And 20 month ke liye 10,000, and yes.
Sorry. That
Yes, this is after the discount actually, 50% after discount only, and 24 plus 2, 26 month ke liye only in 11,000, right? So all of you guys will be getting, I mean this is especially for the launch offer that is going on. So the actual price, if you see, right, for 6 months it is 9,000, and after putting a 50% off, it is coming 4,500. And likewise also, if you see the Prof 1 and Prof 2, if you see the overall, I mean the charges are 18,000, but after 50% off, it is going 9,000, 10,000, 11,000 respectively. So this 50% off is especially the launch offer, especially that is running on for a few days. You guys can take up, and I'm sure all of you guys will not regret this decision.
For sure, and they're like.
these are English. These are English videos.
Yes, this will be English.
These are English recorded videos, and this also includes the digital notes.
Digital notes.
Yes. Right.
And I suppose this particular package, combo package, is the best deal which you can have, and definitely it will make your journey simple and wonderful and next ready.
Next ready.
Anything else, sir? Like how they can go? You can tell.
So you can go ahead, and if you want to enroll and access to these courses that we have, you can visit the website, that is lnnext.com. It's very easy. Simply visit the website, enroll yourself in the course. So we have lnnext, and you can go to the website, enroll yourself in the course, and once you are enrolled, download the app, and it's ready. The content
And
is
we
just
have
ready
this,
for all of you guys.
like if you have any of the queries, and down the numbers are also there. You can call up on these particular
I
ones.
can zoom in a bit if you
Yeah.
want. You can take a screenshot of these numbers. You can just call it up. They will help you out in every step and any step that we have, right?
So this is the way how you enroll up in this particular course, and pricing you already have seen up. I suppose this is what is the best combo which you can have, and start your next ready journey.
Right.
Oh, so there's a question here that says, please let me know which prof is the right time for preparation of next. So I'm sure we can
We already
answer
covered that, and
Yes,
again
yes.
we have to answer it because this is important now.
So
after the
whichever
launch of
prof
next.
you are in, that is the right time.
Right. Exactly.
This
If you're
is
thinking.
now
Actually.
is the right time,
Exactly.
because now I think government has given plenty of hints
Right.
Right.
that they
Lot
are
of
going to
hints are
start with the next in 2024, and whatever stage of your journey, this is the right time. First prof, please, if you are in the first prof or the second prof, please start reading and focusing on
The basic concepts.
concepts and applying those
Exactly.
concepts.
Applying those.
Applying
Clinically.
those.
You have to be clinical oriented right from the first year
Absolutely.
Because
itself.
what is preparation of
Absolutely.
next? It's just simply read your
Yes,
concept for first year and second year,
Exactly.
and then definitely you can take it up.
Actually, a lot of platforms will be telling you that now pre and para will not be like you should not go for them and all. So let me tell you very frankly, if you don't have the foundation, you can't have the building.
Exactly.
Okay. So
Yes.
so that seems like a joke. That if you are going up right from the very first start for the medicine, you will not able to understand anything from that.
There was one question: what are the notes which are included in
Printed notes are available. Printed notes not available, but the
digital
digital
notes
digital
are a
notes
part
Digital notes are
of
there.
what was.
And you can have the printed notes if you want.
If you have to
You
pay
can
a little
access
extra,
extra.
and you will get your printed
But
notes.
in this cost that we have mentioned here, digital notes are
The
included.
digital and annotable.
Annotable.
Yes.
Digital and annotable notes are
Absolutely.
going to be available.
Yeah, mnemonic session will have for sure.
Yes.
Status of
There will
biology
be
is-
lot of mnemonic session that is coming across, and you guys will appreciate all those sessions that is coming across.
Images, graphs, mnemonics, all that. Anything which is going to help you to retain. Picture-based, images-based,
Yes.
and graph-based as far
Yes.
as physiology is concerned. Plenty
And
of
same as
graphs.
And now, like, we will be taking up clinical cases also, ma'am.
Yes.
We will be including. I have done that in my subjects. Like, I have included up the clinical stuff there itself, along with the microbiology. so that you are next ready right from the second year, and the same is being done by the other faculties also.
Yes, we have already, like, in my subject, I have already covered all the clinical cases on vitamins. So that is already available free of cost on the YouTube session, right? So you can even access that, and definitely you should try that.
You can have as a demo.
Yes,
That thing.
right. Definitely.
How is the introduction of the next exam going to impact our preparation?
Another question, ma'am.
Yes. So introduction of the next exam, you must understand what is the next exam, what is it, what are the kind of questions that are expected in the next exam. They're basically integrated, applied. And so what are we going to focus on is, as far as your preparation is concerned, is you have to have a very, very clear knowledge of your concepts, build up your concepts, and you have to learn how to apply them in a clinical setting. And that's exactly what we are going to focus on. Your preparation will be, not only will help you become from a good to a very good doctor, but it will also help you clear your and do well in your next exam. And that's exactly what our focus is also going to be.
Exactly.
What? Okay.
So if there are any more queries, definitely we can take up. There are a lot of students joining from different colleges.
Yes.
Thank you very much for all of you guys. I hope that you guys are able to go through this content, and I hope that things are pretty clear here, and you will take advantage of the launch offer that is going on the platform.
Yes.
And we already told up like how to enroll up.
Right.
That is a simple procedure. That enrollment and all. Acha, like
Right.
some question is there. I'm a first year student from Andhra Pradesh. How foundation program will help me to clear my Prof exam now?
Again, it's a repetition of exactly what we have been focusing on. Our aim, clarity of concepts. Build up your concepts. Learn the subject in the way you are meant to. In the way that you are.
Ma'am, please continue.
Ji. So, like I said, our focus will be conceptual lectures. Make sure that your concepts are absolutely clear and how you're going to apply them. So that's what our focus is going to be. So not only will it help you in your university exams, also in the next exam.
Ma'am, you can take some example also if you want. Like you have taken the ventilation perforation one. Another one, anything.
Yes, all right. Now, for instance, we
Because
talk
they are
about.
first year students, they will be loving that.
Okay.
Uh,
All right. So now, it's a simple thing. You know, there is, when you look at the cardiac cycle, when we look at JVP, you know, there are 3 positive and 2 negative waves. Which are the 3 positive waves? A, C, and V. Now, what is the A wave due to? A wave is due to atrial contraction. Now, when the atria contract, there is a positive wave which you see in the right internal jugular vein. When I say positive wave, that means it is an outwardly directed wave. Now, when am I going to see a prominent A wave? So once you know the basics, what is causing that A wave? Like I said, atrial contraction. Now, in which clinical situation am I going to see a prominent A wave? A prominent A wave means when the atria are contracting against a resistance. And what is that resistance going to be? Now, between the right atrium and right ventricle is a tricuspid valve.
Right.
So if this tricuspid valve is stenosed, it does not open properly.
Right.
So atria has to contract with more force. So what will happen to the A wave in the JVP? Becomes prominent.
Wow.
Now there is something known as a canon A wave. You know, a canon. So the canon A wave means it's a very large A wave. Now when am I going to record a canon A wave? Is when the atria are contracting against a closed tricuspid valve. Remember, when the right atrium has to contract, the valve should be open. But if it contracts and the valve is closed, so the entire force which is generated by the contraction of the right atrium will now be seen as a very, very large A wave. That is called a canon A wave.
Right.
When does this happen? This happens in what is known as an atrioventricular dissociation, or it occurs in what is known as junctional rhythm. So we'll speak about that in our lectures.
Lectures.
So just a very brief
Wonderful,
look
ma'am.
at
Very well
what.
explained, ma'am.
Very
Really.
good.
Thank you.
And we just
I
revised.
would like to learn physiology again.
Right. And
This
some
is a group of highly,
Right.
highly passionate teachers.
Right.
Mhm.
Our only focus in the last last whatever decade, 2 decades
Yes.
has been our students and only our students. And how can we make this journey for you easier?
Yeah.
How can we make you enjoy your journey through medical college? That's exactly what our focus has been and is going to be. So this is one group of highly passionate and dedicated teachers.
Yes,
Right.
just like those of my students who can understand Hindi, like there is a dialogue in Pathan movie कि बात करते हैं हजारों but है तजुर्बा हमें यारों.
Oh.
Definitely we are experienced and तजुर्बा है हमें.
Fantastic. Great.
I think there was one more query. The student was asking how many hours second prof lecture videos are there. So when you compare, I mean, second prof में path, pharma and micro, you'll be having around 180 to 200 hours, including our main videos and also extra his videos. So there you'll be having around 200. So
And
it's
even we
neither
are
very
providing rapid review.
right, and neither very much and neither it's very less. So it will be the exact amount or the crisp content that you actually want, right?
Somebody's asking about like
How
book.
many years of PYQ? See, it depends on right now.
Minimum 5 to we have
minimum
covered.
5 years, so we have already covered. But in upcoming days, like let's say if upcoming examinations are coming, we'll keep on adding as the examination proceeds.
True,
we
true.
keep on adding. But right now, if you're going
This
to
is continuous procedure.
yes,
It's a
yes.
continuous,
5
and that is,
papers you are definitely going to get.
and that's what happens when you have an app which is dedicated to
Excellent.
yes, where we keep adding and we keep innovating, we keep making sure that you remain updated as far as our subjects are concerned.
And by the time you are appearing for the next exam, definitely will be having almost 7 to 8 years of papers
Exactly,
already.
exactly.
with-
True.
Siraj sir, you are my all-time favorite. I mean, this is a student who's saying this.
Yes,
And
thank you very
if
much.
I
thank
become a consultant in future, Siraj sir, you will always remain my
Thank you.
all-time favorite.
Thank you
Fantastic.
very much. Thank
And
you
this
very
is
much,
what-
Dr. Prabhakar Ishwar.
This is what we thrive
learn.
on.
This is your
and-
real
yes,
learning. This is your real
absolutely,
learning.
absolutely.
And we have one more query to pass next one. We have to get 50% marks in every subject or combined 50%.
No, every
It's in
subject.
every
Every
subject,
subject.
and
Every
cumulative should be more than
subject.
50% also.
Yes, yes.
every
It's a-
subject.
There
Every
are a
subject
lot of
passing is important.
twists in this exam. which
Even
we
in
have to-
practicals and theory.
Yes, yes.
Thank you very much, Dr. Prabhakar Ishwar, and all the other students.
And like Yogesh is telling like what is the best book for microbiology. Guys, now what they're telling like competency based and all. So actually, as per me, the best approach is organism wise, and then you go into the systems and all. That will be the best. Otherwise, what I am seeing up in the medical colleges nowadays, they are confused up in this itself, that which particular organism is a bacteria, which particular organism is a parasite. So they are fully confused in that. So the best approach is this itself, that you should know about the organism first, and later on you can like integrate them into the systems. Okay, so that should be your approach. And Apurva Shankar Shastri is one of the books, which is the latest one. Along with that, Anant Narayan, the age-old one, and still going strong. That particular book, and they are the ones which are good for the microbiology.
Sir, there is one more query for you. Please add latest test in microbiology process, Vitec, and other tests that is regarding principle.
Where it is?
I think there is one student.
See, Malditov is nothing but the mass spectroscopy. That's the principle of mass spectroscopy.
By Madhusudan can be.
We'll do that, Madhusudan, for sure. The Vitec and Multitop we are using up in our labs.
बहुत important.
Okay, and I will be telling you regarding this Vitec and all. So no problem in that. So we'll be covering in that. Anything else?
There is one more query, again the same question, that in which prof should I start preparing? As ma'am said, in the prof that you are right now, right?
Yes,
When
absolutely.
is the right time? Now
Today
is the right time.
is the right time to
right.
start. Are these courses, somebody has asked this question, are these courses too exhaustive or very on point and concise?
I think we'll go with the second one.
Yes, but at the same time, that does not mean that we have not explained things to you and made it only factual. No. They are concise, they are crisp, but at the same time, they are making sure that all your concepts are very well understood.
Right.
So it's not just a factual presentation, it's also very, very important that you understand all the concepts.
Right. Ma'am, there's one more query by Dr. Himanshu.
Yes.
Will this foundation course help in preparation of next only or for university exam? This is the same question. That
Both,
already
both,
asked.
both.
It's for both.
This we are telling again and again.
Yes.
This is for both.
Maybe the student joined late. So once you prepare for your first year, first prof, second prof, this will be, this is the knowledge that you are going to use in your step
Yes.
one of the next. So
Yes.
we say both, right?
Yes.
It's for both. And how many video lectures are there in Prof 1? Gaurav has asked. So in Prof 1, as we have already said, that around 150 to 160 hours will be covered. For an art, physio and biochemistry.
125 plus hours for Prof 1 and 150 plus for.
And this will, in addition to this, we'll also be having the extra edge video. So that's why I said 150.
Yes, you're right, I'm sorry. Yes.
So this will be?
Yeah, for NICT also this will be there, but I suppose when the next comes, these all will be merged up in that itself.
Right.
Okay?
We have Dr. Khandelwal who will be joining us
Yes,
shortly.
definitely.
He is the anatomy faculty. Meanwhile, I'll take your leave. Thank you very much and all the best to all of you. Yes, and please stay tuned. Dr. Ankit will be joining us.
Yeah, stay tuned, all of you. Dr. Ankit, anatomy faculty, will be joining you soon.
Hi guys, so on the demand of the students, we are back again to take a few more queries that we have, and not only us, we have ma'am here. She will also be having some query that she got through mail or through WhatsApp. So she'll be asking those queries as well.
And we'll be answering up.
Yeah, and we'll be answering those queries.
Hi everyone, so we are getting a bunch of queries all across YouTube and WhatsApp, and we just thought to let's bring our respected faculties back and ask them face to face what questions you are having. So bringing on the first question to Sonu sir. Hello sir.
Yeah, please do.
Okay, so we have kicked off with a very good and enjoyable mood. So sir, the first question that the massive student base is asking right now is that they've just cleared their NEET UG or medical UG and they have entered their MBBS journey just now. Why should they prepare for next, or why should they invest in the foundation course?
So the very reason we have already told up that now the time is less of yours. Now the things which are coming up after the internship, now they are coming up before that in the 4th year itself. So obviously you have to have that foundation right from the first day of your medical career. Okay, so this is what is the importance,
Right.
because you have to start up early to gain that advantage. And obviously when a student from UG comes to this particular platform, might be having a lot of troubles like anatomy, physiology and biochemistry. They are the real ones which gets into the head. Very like it goes away, in fact evaporate directly from the solid, it becomes gas. And this what happens. So this is the way, like if you start up early and with this Allen Foundation course, you will feel the things to be palatable with that. And if you like go up in the, like suppose you have started up early, so that particular thing will help you to
Right,
gain the
right,
race of that
consistent.
particular next exam wonderfully. You will have a wonderful rank also in that particular one. So that's why this is the
And also,
reason I suppose
I
you
believe
should
ma'am
start
was
first.
telling earlier, we had the same kind of query a while ago. What she said, what is the role of the faculty? You see, you have all the university lectures, you have all the textbook. What is the role of the faculty? Simply to make the topic, to make the concept easy, to make it more palatable. And after going through these lectures, once they go back again to the book, they will be in much better position to understand those concepts. Because I believe there are a lot of things that is given in anatomy, physiology and biochemistry, especially for our first year students.
True.
They cannot go through everything. But the must know things faculty knows, right? What are the essence of this first year faculty knows. Once they explain those topics, and then retrograde once the student goes after attending these lectures to the book, they'll be in a much better position to understand those concepts. So that is one very important reason that I can say that student can add up, and definitely once they have joined medical colleges, this is the time that they can enjoy a bit, and they don't need to stress themselves, they don't need to make themselves wait for 1 year or 2 years to finish, and then they'll start. No, study less, but study consistently. Thoda, lambe samay ke liye.
Tortoise will win.
Exactly.
And while they are already preparing in the colleges, they can also be in line with the strategic preparation for next as well. These courses will serve them into a pattern study, a strategic tailored and customized study for next as well, right?
True.
So, that was an amazing answer. Thank you, sir. So, okay, as you can see, I'm handling multiple questions, multiple devices. Okay, sir.
Rohit Sharma.
So, let's see more questions up here. So, could you again, the kids are asking about the CBOT, sir. So, as we have announced that we are going to be having 15 plus pattern-based tests, so how CBOTs are embedded in these? CBOTs would be your computer-based offline tests. So, we are going to be having
the query was that whether it will be computer-based offline tests or only online. You see, there will be for this package you are going to get online tests, but if you want to be a part of computer-based offline tests, that is also going to be available for all of you guys. So, if I'm not wrong, there will be 100 plus centers across the country, which the list will be announcing very soon. And from whichever city you are, you can choose the nearest city to you, and you can go and you can attend this test. It will be very much similar to the actual exam pattern. I mean, the environment of this room, the entry in that room, sitting in that area, right, facing the screen, right, facing the stress of the screen, everything will be very much similar. And of course, the question pattern will also be in very much similar pattern. So, will it be only online? For this batch course, yes, it will be there in the app, but the discussion will be live. And if you want to be a part of offline tests, definitely you can attend. We will be announcing the list of those centers very soon.
And dates very soon.
Yes.
So, another question that's popping out regularly is that which of these subjects require extra attention or more preparation, and how can the kids ensure that they are not going to do bad in these particular subjects?
Every subject needs
every
this
subject
type
is
of thing.
important.
Like
I mean, this is a question that should not come to you. See, once you are a doctor, you are going to be a doctor, right? You start from anatomy, go till dermatology or radiology. No subject is less important. If you're going to put importance more on, let's say, medicine, definitely medicine is a vast subject, and you'll be getting more or less around 40 questions. But if you're giving less importance to subject like forensic and radiology, no, that's wrong. Although the subject is lesser, the number of questions that is also going to be asked will be lesser. So the smaller subjects definitely are better in terms of scoring. Bigger subjects are big. They contain a chunk of the entire syllabus, but the number of questions, I mean the content that you have to cover is also very, very vast.
And if we talk about the first year, sir,
yes,
anatomy, physiology, and biochemistry,
right,
I think all the three are
the base
needs to be
very, very,
like
very
understood in the
no
better
subject
way.
is less important. All subjects are equally important.
That's true.
Exactly.
And obviously this is what is the logic of this foundation course, that anatomy, which is like everybody feels that new words have come, okay, and these particular things are like mediolateral and all that, so they are tough for the first beginners, but that's what we are here for this foundation course, that they all become palatable. You're able to understand them wonderfully. Like ma'am have said, physiology, wonderful concepts, like sir is there, Dr. Amit, so biochemistry topics will be becoming palatable, and along with that anatomy also in that way. And obviously for the second prof, we are here, and they will also become up in this particular fashion palatable. So obviously every particular subject is unique, and it is having its own discrepancies that needs to be handled.
Right.
Okay. So,
and so again, the students are asking, how much time should they devote to their preparation, starting on Prof 1? let's say a student is not a very hard worker, not very much of a devoted person, but still wants to excel with good ranks. So how much time on an average every day should he devote into the
Every day?
foundation course? Yes, sir.
Every day. Every day. Now, if you are really asking this question, I would say a very shocking statement. If you are going to spend just 1 to 2 hours a day, how much I said? 1 to 2 hours a
Wow.
day.
True.
That's it.
True, sir.
Just 1 to 2 hours,
Ma'am,
sir.
that's if you are going to start early, that's the thing. If you are going to start in the, let's say, final year,
Right,
you'll
sir.
be the 24-hour might be lesser.
Mm-hmm.
But you are asking the question that right now students are in first year or second year. As I said, you'll be shocked to see, shocked to know, shocked to hear 1 to 2 hours a day, and that
1 to 2 hours on a consistent basis is
Consistent
more than
basis.
sufficient.
Exactly.
And important here is
Yes, sir.
that you should enjoy your first year also,
Ah,
because you are in the medical college.
Mhm.
Okay, that tour of becoming a doctor, so that you should have, and you should feel that movement of your first year, because the memories with your senior interacting firstly with you, so they will always be there in your MBBS life with you. And those persons who met up in your ragging, because before the ragging was used to be there, now it's like sort of banned up.
Right.
But the
Sort
things
of.
with sort of only. So actually, this is what is there. Me also be remembering of my first year incidents the best, because that is what is the interaction firstly with our seniors. That feeling of becoming a doctor. So they all are unique. Feel them in that way. Don't just study. So basically, the purpose is, as sir told, 1 to 2 hours, and along with that, do whatever you like in the first year. If you do this much also, you'll able to excel up in the prof exam also and for the next also.
Exactly.
But the important is consistency.
And sir, as you just mentioned that 1 to 2 hours would be just enough. So are these foundation courses, customized in a manner that they would not have to go on to exhaustive studying, and just 1 to 2 hours would be enough?
It has been customized in a way. The answer to your query is yes. It has been customized in a way that you just go ahead, watch it out, and if you have time, more time beyond that,
Absolutely.
definitely you can spend some time on your MCQs as well. And one very important thing that I would say that keep one day absolutely free for your or leisure, for roaming around, for not totally for you, especially if you are in first year or second year student. Right? Don't take too much load. That is what we are trying to say here.
So basically, the customization is in that particular sort that, as ma'am told, she have make you understood that particular thing, and this is the way to approach her. Firstly, read that exhaustive one, okay, and after that you will be having that this is the bare minimum which I want for the prof and for the next exam. So basic purpose of ours is to emphasize that this particular organism, Staph aureus, in my subject, is causing up multiple diseases. So you should know in and out for the Staph aureus. So this is what is the approach. Other rare bacterias, they remain a rare ones. So you can leave them also or just have a hint regarding them. So this is the way we have there. And this is the importance level also we have kept up in the videos, that Staph aureus is the most important. So that needs to be given up 1 to 1.5 hours of Staph aureus itself. We are consider upon these particular foundation courses. So we have them in this particular sort only. That you should know that Staph aureus is an important one, and you will be finding them in your hospitals with various names like MRSA, methicillin-resistant Staph aureus and all. How to go for the hand hygiene. Okay, so these particular basic things we are inculcating right from the first and the second year stuff in you. So this is what is the logic of these foundation courses.
And sir, since the students are a little worried and a bit anxious about the next examination, they're also asking that would there be any tests or something that would exactly pattern to the next examination? Will we take one about the tests and discussions that we were saying?
We've
about?
already
Yes,
told
yes,
of this
we have
thing.
already told. I think some students are joining late and they are asking the same kind of query. That there are 15 plus tests that is going to be conducted, and along with that there will be live discussion. That live discussion will also act as your doubt clearing session. Right? So next is not something that is coming from Mars. I'm just telling you the name is changing. Anna, the name is changing, right? Somewhere
Absolutely.
the name is changing. Everything else remains the same. Maybe there will be some changes in the pattern of asking the question. So as sir was telling that there will be some topic on MRSA. So maybe they can give you a microbiology scenario of MRSA, and then they can ask you what is the drug of choice for this scenario, right? So earlier it was like this drug of choice for MRSA, methicillin-resistant Staph aureus, but now they can give you a clinical
Case
picture.
scenario they will give.
Exactly.
That you have visited a hospital, you have
Exactly.
isolated one, with the swabs, some MRSA, now which particular drug you
So
will
what
like
is the
to
drug
give.
that you will be giving?
So this is the
Or
way
a
they will
drug
be
was
asking.
given, a drug of choice was given, what would be the possible side effect?
True.
Right. So earlier they used to ask that which of the following drug will be causing Redman syndrome. So instead of asking that, they will be changing the pattern. I mean, a little bit change in the language. That is what. ना next का नाम सुन के ऐसे डरना नहीं है ना कि बस क्या आ गया, कहाँ से आ गया, कौन है ये, है ना, ऐसा नहीं है. अपना ही भाई बहन है और अपने जैसा ही होगा. It will be same like ours only.
डरना तो नहीं है.
डरना
देखो
नहीं
डर के कुछ नहीं होना. Basically क्या है? Only thing is that you have to start early. That's
Exactly.
all. Because before it was like first to second year they used to waste up. Like they say that yeah, third year will start up and all. The only thing I suppose the change is that you have to start early now. And if you do that early on consistent basis, 2 hours is also more than sufficient. But 2 hours need to be given.
So there is one query by Hitesh Joshi that can you recommend any additional study sources such as textbook, online material or practice question? I mean, you see, you are in a medical college, especially for a first prof and second prof student, whatever textbook that you have, that is sufficient. But in addition to that, as a helping tool, this app will be helping you out in understanding and making sure that you are not missing the important contents and you are understanding the main chunks in a very simplified manner. So this foundation plus your textbook and this foundation course is having everything that you need. You have video lecture, you have rapid revision, you have PYQs, you have test and discussion, you have a lot of MCQs, everything that you need, it's there at one touch for all of you guys.
Mukul
So I
Gautam
don't
sir,
think-
Mukul Gautam is asking what's the proportion of weightage for first and second prof subjects in next exam. So this exactly what we are talking about. So this weightage does not count now. Okay, at such 10% is there officially, but that 10% when you go up in the exam now you will feel that 50% it is.
Exactly.
50% it is because what happens like nowadays, like itself, if you see this NEET PG, INI CT exam, previous ones also if you see up, you will feel the question is coming of that sort only, and this is what is next is. Okay, so this weightage does not matter at all. That this one, because how you can exclude up micro from the medicine, how you can exclude up from the pharma.
Physio,
Okay,
patho, pharma, micro, they are medicine.
so exactly with the clinical features, that is what is medicine is.
Exactly.
And to know them better, obviously you need to have the Prof 1 also, because they are helping you in certain final year subjects also.
Okay.
Like in surgery and ortho, if you don't know the bone stuff, so how will you perform the surgery in well? So this is the way. So basically this is like a sort of a myth that only this 10% is coming and why we should study. So this I have already tackled up this query. So basically this particular exam is a qualifying exam, so that is fine. Another is it is for the PG also. So according to that, you will be getting up the subjects of your choice. And you know in the PG race, if one question of yours gets wrong, then you are out of the race. Okay. So this particular thing needs to be understood that if you are having...
We have another question, sir. They are flowing up. So the question is that, are there any specific areas or concepts or topics that are frequently tested? And we can, anticipate them and work upon them?
That is what you are going to see in PYQs. 5-year PYQs will tell you what are the important topics, what are the different areas that are very
Trace
frequently
questions
going
and
to be
general
asked,
questions.
right? And in addition to that, ma'am, I think there is one more question that can you explain more on rapid revision? Now, what is
Right.
rapid revision video, sir? Over to you. What is rapid
revision
actually?
videos, obviously you know that this is a highly cruxed one. Okay, in that you have those particular things which needs to be done because they are coming in exam. But this is for sure that if you are not well prepared with your basic ones, rapid revision videos will not help much for
Right,
sure.
right.
So that to be very sorted up, that you need to have the main ones first and then go for the rapid revision. Go for the shortcut. If you go for the shortcut, that will be detrimental, I suppose. Okay. So you need to add something.
As sir was telling, rapid revision in previous question also I have answered this, that rapid revision is the crux or gist of everything that we have covered in main video. Like the entire pharmacology syllabus of around 60-65 hours I have covered in around 12 hours. So that will be 1/5. So in this 12 hours, 10 to 12 hours around, you'll be able to revise most of the important areas, and this is especially for those students in which let's say they have read it already and they want to revise
Last
very
minute
rapidly,
revisions.
last minute revision kind of
True,
videos.
true, true.
So let's say you have exam after 2 days and you want to revise this content, definitely this will be a blessing for all of you guys.
And so now we are going to be with very respect introduce Dr. Ankit Khandelwal sir from Anatomy.
Yes.
Please come over and join us, sir.
Yes.
It's a
Hello,
pleasure
sir.
to have you here.
Thank you,
We've
thank you.
been
Thank you,
waiting for
sir.
so
Thank you,
long.
Dr.
Hello,
Siraj.
Dr. Ankit.
First of all, my sincere apologies to all of you. It was a bit of some emergency, but last but not the least, privileged to be with our respective faculties over here, and with this one for all comprehensive dream course launch, foundation course we have over here. I am Dr. Ankit Khandelwal. Let me introduce a little bit of myself. I've done MBBS and MS in anatomy, so I have a faculty of anatomy over here, and I've been teaching anatomy from the past around 14 years. And not just me, take any faculty of our LN next. Everyone over here is so much of experience, experience in every sort of teaching methodologies that you will yourself experience the difference and the benefits of getting experienced faculties over here. So over here I'll be taking up the anatomy classes, and as sirs have already must have introduced everything about the courses and all.
Right.
So this is how we are going to.
Sir, one of the queries was like dissection videos will be there or not?
Sure, that is very, very important, and we are trying our best. And let me tell you, good news that most probably it is 99% assured that we are going to have some dissection videos. And if live dissection, if we are able to show that, that's nothing like that.
That will be wonderful. Sir.
Because actually that will take time because you have to be over there for 45 minutes for one particular part. So
True.
maybe we'll be just reflecting up the layers and show you that where's the organ, what are the relations of it. That we are trying our best, and at least we will show you at least the organs per se, they are located in situ in our body, and the relations, because that is what is all anatomy all about. Because
Right.
because as a first year, what we all are confused that such a big trunk, where is liver, where is spleen, where is kidney, we all have that vague idea. But seeing it inside a body, inside a human body, and that is what I think a human cadaver has an edge over any technology if you can see it. So let's hope for the best, and hopefully it will be there. So I hope that answers the
Sir,
question.
there was one query a while ago while you were not here, that
Mhm.
how many hours of anatomy content is there for our students here?
For our students, see,
For anatomy.
there are 2-3 different things over here. We have a complete main video lectures, so that will be somewhere around 50 to 60 hours. Could
That's
go
good.
extend a bit more than that. But rapid revision will be around, we can say 1/5 or 1/6 of the total time if we
Right.
go mathematically. So it will be roughly around 8 to 9 hours. But
Okay.
it is not a shortcut, let me tell you. So
Mhm.
it is not oh, rapid revision, let's forget the main video, let
Mhm.
us see it now. Then you will be at a fault, you will be wasting your 8-9 hours over there. Let me warn you beforehand. So it's going to benefit only those who have gone through the main videos.
True.
Else the rapid revision is not going to help, and then we will have extra edge. In anatomy, there's a lot of scope for extra edge. So hopefully we'll have some surface markings, we will have some dermatomes, we will have some vessels,
Viva
how to
questions.
palpate, viva questions. And let me assure you that I'm sure that if you take the 19 subjects of MBBS, then top 3 or 4 fearful subjects, one of them anatomy will be on the list. I guess microbiology or pharmacology, they are also in my fearful was biochemistry. Sir must have explained about biochemistry, but that was my fearful subject. So let me assure you, not just me, but every faculty over here, our main job is not to just go through the data and teach you what is there in the subject, because that is available everywhere. Our job over here is to make it simplified, make it understandable, and make it more interesting. And as a doctor, how do you feel by reading any subject, how it will help you in your clinical practice? Because that is our main role.
That orientation should come right from the first day.
Right from the day first.
That how you correlate with the clinical.
How we
ones.
correlate, because
And we have done that in this.
Obviously. Because when you go for your first vacation at your home, पड़ोसी आके बोलते हैं और डॉक्टर साहब आ गए. So that doctor साहब feeling should not be only अरे अभी तो बने नहीं, but we will give you that feeling. Don't worry, and you will yourself enjoy that feeling. So that is why there's LN next, and why there is next exam, that is for the clinical orientation. So I guess that's going to be very
Now there
helpful.
is one more query that student is asking, that is there any 3-month course? No, I don't think there is 3 months. So the course duration that we have discussed here, 6 months and 12 months. So it's just very reasonable. The prices that we have right now is much reasonable for all of you guys. So even if you want to read for 3 months in this one, is totally up to you. But this is the smallest package that they have for 6 months. And see what examination.
Let me add over here, I don't think 3 months will be practically good.
Exactly.
Talking on a student perspective.
Yeah, I think sir,
Especially
these are
for
those
top
students who
students.
are in the end of the
So,
session.
So
No, they can go ahead with this one,
Huh.
with the Prof 1 and
the
Prof 2
Prof
package.
and Prof 2 package, that
Yes.
is wonderful. But I
Yes.
think minimum 6 months is needed for you to digest the information.
Exactly.
It is not just going through the newspaper. It is for you to understand, and so I think 6
apply
months is
it.
needed.
Yes,
Apply.
and there is one more query. Will the language of lecture means English or Hindi or mix? So mainly right now we will be having English lectures, and there is one more query whether they will be getting printed notes or not. With this package, you will be getting digital notes and the annotable.
And you can download
You
them.
can download that as well. That is another query. You can download them as well, and digital notes, colored digital notes will be there. Printed notes you can avail, but for that you need to communicate with the numbers that is given on the screen, and they will facilitate with some extra cost for all of you guys. The printed notes will be available for students, those who are taking the full package, like the alpha package. But for other students, that is those who are going to take 6 months or this one, they will be getting the digital notes. Printed
So,
notes is not there in this.
One of the queries is, can we connect with the faculties for doubt resolution?
Yes.
This
You
we're not telling
are
them.
just one touch away from all your faculties. You will be attending the test, and after the test, you will be attending the live lectures. In that, you can connect, and not only that, we are also going to form, a specific Telegram or WhatsApp group, whichsoever is feasible, in which you can post your queries, any query that you are having with respect to your preparation, especially for first or second year students. And I think previously also, sir, ma'am was telling that students are having a lot of queries, especially in first year, anatomy, physiology, biochemistry, and so, some of those queries are very silly.
Silly. So
that
they don't ask.
They don't ask, and that query remains in their entire life, medical career.
Mhm.
So you will be free to ask any of those kind of queries related to your subjects.
I think we should actually, LNX is trying over here to change the entire way the teaching has been and it should be. So moving to that should be. So there should not be any hesitation in asking any small thing. Like what is the spelling of muscle? Do we call it mushkil or muscle? So that is MUSCL. Okay, fine. Ask that. Ask anything, because that is what is needed right now. We should all lose our hesitations. Hesitation should be outside the classroom, outside when you open the app. It should be before that only. There should be no hesitation. Ask all your queries, and everyone is over here. Everyone over here is much more than happy to sort it out.
So
There
one
is one more query. Is there a separate pack for rapid revision? So if you are going to buy Delta pack, in the Delta pack you'll have a test series, MCQs, all the question bank. In addition to that, you are going to get the rapid revision absolutely free with that.
And sir, one question, is there any particular areas and topics they want where students commonly face difficulties in the exam? So for anatomy, you can tell, sir, that what are the topics which they don't understand.
See, anatomy, to be very frank, there is no
Special topic.
No special topic over here. A is difficult, N is difficult, and Y is also difficult. So anatomy total is difficult, but only if you don't understand. See, what is difficult, what you don't understand, that is difficult. What is easy, that you understand, that is easy. So after attending the classes, not just anatomy, any other subject, so these are topics, and you will see that we have so easily clinically integrated those topics. I mean, nothing over here is without integration, let me assure you that. Every single word over here, every single chapter is clinically integrated, because the motive of MBBS subjects are for you to become a doctor. That is the motive.
True.
So every chapter should have a clinical integration, else the chapter should not be there. Else there's no use of that chapter. So we have touched over here with our experience, including because we have cleared the MBBS, we have done PG and all, because we know a bit of more clinical cases than you first and second year guys. So we have integrated all of that. So every chapter will have clinical integration, not just in this subject, but take any subject. And there is where the fun is. There is where you are going to enjoy what is this professional course, why we call it as a professional course, why it's not a simple or any other simple regular course, why it is a professional course. And that is what we are going to have over here in all the subjects. I hope it answers your query.
Yes, there is one more query by Dr. Gaurav Singh. Are these classes delivered live or recorded? So guys, all these package that you are talking about here, it's all recorded. Live discussion will be there every time you give a test. So that will be test and discussion. Discussion will be live, and that will also act as a doubt solving session for all of you guys. So you can have your doubt even from textbook as well. You can bring your doubt from your colleges as well. So we will try to answer those queries. So the package that we're talking about, it's not live, it's all recorded content that will be, and you will be able to access them from the comfort of your own city, and as per the time that you have after your classes or as per your own schedule.
So it is actually a past live, but now it is recorded. So it is partially live. It was recorded live.
Yes.
Now you'll be watching it recorded. So it is not something coming off from somewhere else. It is a recorded, but you will have the discussions that sir has already told all of us.
Sir, somebody is asking if foundation course we take for 2 years, then later we can upgrade. Surely we can.
Of course.
Surely we can, and those things will be sorted up later on. We'll be telling up that how to upgrade and all. So
Yes.
that is in the pipeline.
It's a secondary issue. Yeah.
Yeah.
Change is the law of nature.
Yeah. So, any further queries, ma'am?
Yes, sure.
So I think we have told up regarding most of the queries and all.
You've answered all the queries, I guess.
Yeah. And sir, some motivation from your side for the
Motivation
first
from
year?
my side. Okay.
Yeah.
Motivation, single motivation is that you already have entered MBBS.
Right.
So that is the biggest motivation. You just visit a
Sir,
hospital.
so tell about your journey of that first day.
My journey.
First day, that when you entered up firstly in the medical
First day,
college.
sir.
So that, will
That
be
was
good
more than
opportunity.
2 decades back.
Mhm.
And firstly, let me tell you honestly, I will not talk that much in detail in public domain, but I got beating outside the gate of the college. Well, when entering into the college, so in that time the ragging was there. So we got beating from there only, day one. And then
Ragging, so-called ragging?
yes.
Physical one.
outside, physical, outside the gate of the college.
Mhm.
I'm from Lucknow, KGMC, so it was a huge area, chalk area we used to call, some of you might be familiar with it.
Kafi bache
And we used to
Lucknow
get a
se.
beating from there till our Department of Physiology was our first lecture.
Mhm.
So, and yes, for 6 months ragging continued, and we actually started reading from the 7th month. Because in 6 months we were not, we had no time to touch the books, but that was that time.
Right.
We adjusted accordingly. So it's just a nostalgic feeling, it's our memory, but this is this time. So you don't relate this with that. That was a different time. We didn't have much of mobile phone. The distractions were less. There was not that much of a girlfriend boyfriend culture, though it was there, but not that much. Nowadays distractions are more. I personally feel this time is more challenging
Challenging.
than our
Actually.
time. I personally feel that.
True,
So
true.
therefore, it is also good. See, God balances everything. We can say that the creator over there made a course like this to help you guys, so that you can move from distractions and you
Exactly.
can use this course. I mean, this is a dream course. If this course was launched in our time, no, it would have been sold like Apple iPhone. Really,
True,
in just 1 minute, it would have sold like anything. Because this is a dream course. Just think about it. You're getting everything. So you are partially
Things have been
privileged.
simplified.
Yes.
This is what is hand holding.
Exactly.
Yes.
This is a proper hand holding.
Proper handling, yes. So
For
you
your
need to
next.
be more focused over here, and that is also.
So will there be performance analysis on ranking basis? Yes. So the test that we were mentioning, this will definitely give you analysis. And what's the duration of rapid revision? Mukul Gautam is asking, doctor, as we said, more or less it is 1/5 of the video. For example, let's say 60-62 hours of pharmacology will be covered in around 10 to 12 hours, sometimes 13 hours. So 1/5 of the regular class video will be the rapid revision.
But sir, like emphasize on this fact that don't go directly for the rapid
yes,
revision.
don't directly jump for,
For
the
first
rapid
and second year, it
definitely.
is not.
It's totally.
They should go for the detailed one,
Yes,
and later
going
on
to
they
be
can
better.
turn it to the
Right.
rapid revision.
Right.
Okay, don't do that mistake.
Mhm.
And sir, but you're telling about what your first year, but for sure you must be remembering that only now also after 2 decades also you're remembering that particular memories only.
Those
So
are the memories.
for this we want to tell up that studies is fine. Okay, you should study on the consistent basis, but you should enjoy also, because this is the start of a new journey, and this particular feeling of being a doctor, feel that, and be the best of yours in every aspect. That's what I said, say also every time in my classes and all. You should be a better version of yourself every day.
Every day.
Okay, and if you start up that better version forming from the first day of your MBBS, you will be at the top in the next exam for sure.
Definitely. Yes. Ma'am, you have some query, I guess?
Yes, sir. I'm back in the
Please.
picture with some more queries. So the first one happens to be from Rahul. Is it compulsory to study full course from first prof for next exam, or do we play from the third prof? Like, what's the importance of taking these courses in the first prof? Why should one take it in the beginning?
We have answered this.
right from the starting we are telling up that why you should do that.
Right.
So but I think they are those which are late joiners.
Mhm.
So this is what is there, but
Foundation.
And so
this is this like firstly when you start up having the A B C D E F in your childhood, and then you start up word building and all. So this is what is that anatomy is your A B C D. Physiology is ABCD, biochemistry is ABCD, okay? And after that you start forming words and all, so that is the second year. And when you start doing all that, the comprehensions and all those stuffs, that is your third and fourth year.
Now, so
okay?
this aligns to another one question, which is, will foundation course also cover relevant topics for the university examination? How will they help it?
Yes, this also we
So
have
you want to
answered
answer
the
that?
couple of
Bilkul, sure. Actually, the thing over here is, see, there's a story. A student, he topped the NEET UG but failed in 12th exam. So what is the use of topping the NEET UG? If you failed in your 12th exam,
True.
you can't get admitted to the MBBS. Therefore, every student who is in first or second Prof, their first priority will be to pass the university exam. Of course, then what will happen is, after that, you have to add on knowledge over here. See, suppose I'm talking about liver. I'm talking on the surface of liver, about the dimensions, whatever it is, the ligaments and everything. So that is asked in your professional exam. And the clinical correlation of it will be asked in your next exam. So unless and until you understand the basic anatomy, how will you understand the clinical correlation?
True.
So therefore it is helping in both. See, it is not different. MBBS is one course having 19 different branches. All the 19 branches, they converge to make a doctor. So every subject, every chapter, over there, it is like this only. So it is helping in your university exam, plus that clinical correlation will help in your next exam.
Right.
So that's what you're telling me, it's like a tree. And I suppose these pre and para, they are the roots.
They are the roots.
And if you have that particular strong roots now, you will be a wonderful clinician for sure.
Right.
It's actually a dream for me also, because for the last 10, 12 years when I'm teaching, I was saying that make these 6 subjects strong. Everything, medicine, surgery, everything will be clear.
cakewalk.
Will be
for
a
sure.
cakewalk.
Will be a cakewalk.
Medicine is all about pathology, pharmacology, microbiology, and all of that. So just these 6.
And same for
just six
surgery, sir.
subjects.
Surgery is
Same.
anatomy.
Surgery is
Like you
anatomy.
should know. Ortho is all about anatomy.
But don't differentiate surgeon from medicine over here, because the surgeon
Right.
has to write a prescription also, and a medicine guy has to do some procedures like a LP or whatever it is. So it helps everywhere. Anatomy is not only helping a surgeon; it is helping a medical guy also.
True.
MD medicine also. So don't separate them. Everything is single. Everything is united to a MBBS degree.
Right.
Try to understand this point.
And if you agree with me, sir, whenever we used to read up a BD Chaurasia book, so those clinical correlation, they used to come. And we used to enjoy them. Okay, so this is what is there right from the very start. We feel like the doctors
That
and all.
gave us a good feeling.
So that is what is boosted up in this next.
Exactly.
That thing should be more
More.
emphasized.
Right.
And we have done that in our lectures.
And so now the question happens to be, are these classes delivered live or recorded?
This is
So we
already
can talk
answered
about
up.
the
Well, you have already
classes
answered
and the
this.
discussions.
Welcome late joining like me.
So these are all
already
recorded
discussed.
lectures. They are all recorded lectures, not live. But
Yes, in
and-
discussion.
But the
and
unique
after
feature
that,
which you are
yeah,
providing up
yeah.
is that tests discussion, which is
Discussion.
live, and in that you can ask any sort of your doubts, even the silliest one.
Mhm.
So that is pretty clear, I suppose. We have made it.
And we have those groups where you can interact with the faculty. So don't worry that, okay, the recorded and the faculty has gone somewhere.
Mhm.
We are here. We will be here.
Mhm.
So hand holding, we will take you to the end of the MBBS journey, and after that also. Don't worry about that.
True,
Right,
true,
right,
true,
right.
true, true, true.
And one thing I want to add, sir, that someone asked me that should we join the course in first year or not. I think the package is having whole research about 6 months or 12 months. So if you are already past few months of first year, you can buy the 6+ month. If you are just beginning the journey, you can go with the 12 month. Or
True.
you can go with the 2 years if you
True.
find it useful.
Yeah.
So package and all, that's all about research. So don't worry about it. You will fit somewhere. You have to fit somewhere.
Right.
True, true, true.
So I think with that we have taken all your queries, and I hope to see we hope to see all of you guys in classes that we have in test and in the live discussions. And if there are any more queries, we'll be more than happy to answer to all of you guys. You can ask those queries in most of our social media handles, and also in this live YouTube session as well. If you want, you ask. Definitely, you can go ahead. Right. So the course is going to launch today at 5 p.m. That means in just 10 minutes. After 10 minutes, you will be able to register and purchase. And for the purchasing, once again, let me just remind how are you going to purchase. You'll be visiting on our website, that is lmnext.com, and enroll yourself in the course. And once you have enrolled yourself, download the app and access the study resources for the foundation course. At any point of time, if you are having any difficulty, as I told you previously as well, that you can go ahead and you can call on this number. So right now the number I have zoomed it in here. You can take a screenshot of these numbers, and you can call these numbers, and they will be helping you through all
To
these
register
steps that we
for
have.
this particular course.
So this will be about today's launch. So all the very best to all of you guys. Thank you very much.
Hope to see you in the lectures.
Thank you very much.
Bye.
Thank you.
Best of luck.